Dr. Tracy Page, and welcome to Health Made Easy, where we discuss topics focused on hormonal health, weight loss, and wellness. Yes, you heard me. I want to make being healthier easier. Don't get me wrong, we all have to do the work, myself included, but let's make being healthy less complicated. I'll provide clear, simple, and actionable steps that you can implement into your daily life. Really, who doesn't want to feel better? If you're ready to increase your energy, optimize your well-being, and restore your health, then listen up. I love helping my patients and listeners optimize their health and clear away the brain fog, shed the excess weight, improve their mood, and really change the way they age. I am a triple board certified physician, and I created Health Made Easy just for you. Let's get started on today's topic. Hi, welcome to episode 4. Today, I want to talk to you about a very important topic that affects a lot of females that I see in my practice, and that is called estrogen dominance. Now, it doesn't mean that you always have too much estrogen, although that's what the title is, estrogen dominance. It can happen for one of two reasons. So it can happen because, yes, you're exposed to too much estrogen or you have too much estrogen in your body. But the other reason could be because you have low progesterone and you do not make enough progesterone to balance the estrogen that you have. So think of the estrogen as a gas, the accelerator, so the gas in the car, and think of progesterone as the brake. And you really have to have an accelerator and a brake in order for your car to function appropriately. And the same is true in your body. You have to balance your estrogen to progesterone in order to be healthy. So let's dive into this topic because you might think, well, it doesn't apply to me. But let me just kind of run through some things that could be going on for you that could be signs and symptoms that you have too much estrogen or you're estrogen dominant because you have low progesterone. If you have PMS, fibroids, endometriosis, ovarian cysts, breast lumps, you've been diagnosed with breast cancer, thyroid nodules, elevated antibodies to your thyroid, ovarian cancer, miscarriages, infertility, water retention, weight gain, cellulite, brown spots or discoloration on your upper lip or on the side of your face, mood swings, tender breast, irregular periods. So you start having periods that become closer together. You'll have a period for a normal cycle, and then 2 weeks later, you'll have another period or spotting, hair loss, thyroid dysfunction that mimics hypothyroidism, headaches, migraines, brain fog, insulin resistance. So you start gaining weight even if you eat very little carbohydrates, lower libido or no sex drive, osteoporosis, which you probably wouldn't know unless you have a DEXA scan where you actually measure your bone density, and then maybe autoimmune disease, and not maybe, but you can develop autoimmune disease such as lupus. You can get the rash, the butterfly rash on your face. You might develop a systemic arthritis. You can have other autoimmune that starts popping up, psoriatic arthritis, and the cause may be the fact that you have an underlying or imbalance of estrogen to progesterone. So it is a really important topic, one that warrants further discussion so you can understand how you can turn this around. And you can turn this around. I see this so often in my practice. Women come in with a plethora of these symptoms. And as soon as we get their hormones balanced, the things just stop dropping off and they start feeling better. They're sleeping through the night. Their menses is better. They're not as anxious. They are more calm. They feel good. Their breasts aren't tender. They start losing weight. So if any of those things sound good to you, keep listening. So in episode, I think it was number 2, I spoke a little bit about the different types of estrogen, E1, E2, and E3. So today we're going to focus on 2 of the important ones, E1 and E2. So E1 is estrone. It's produced by the ovaries, and it also is produced by our fat cells. And again, it's 5-to-1 alpha receptor, so it's going to cause proliferation. And we don't want a lot of that going on. E2 is estradiol, which is our strongest estrogen. It's also produced by the ovaries. It's the most prevalent form of estrogen. It's the one that gives us our sexual female sex characteristics. So it also prepares us for reproduction during pregnancy. So estradiol is, again, the strongest estrogen. So we use estradiol when we calculate your progesterone to estrogen ratio. So when we're trying to figure out, you can actually objectively figure out, are you estrogen dominant? And we always want to calculate that ratio during your luteal phase. So a little bit of anatomy here. we have two phases of our cycle. We have our follicular phase, which is day 1 that you start bleeding, and it goes up to day 14 in most individuals. And then we have our luteal phase, which starts from the day of ovulation and goes up until we start our menses. All right. You want to check your progesterone level during the luteal phase. Progesterone is responsible for maintaining the uterine lining and maintaining pregnancy during the luteal phase and beyond if you become pregnant, if there is a sperm and an egg that meets. Progesterone also reduces inflammation, it calms the nervous system, and it helps to stimulate our thyroid. So progesterone is so important in the body, and it's very important that you know your levels. So I always encourage my patients that we check your estradiol and your progesterone level at day 21, but there's a range, day 19, 20, or 21 of your cycle. And day 1 is the first day of menses to make that calculation. Okay. So just think 3 weeks after you start your period, go get your labs checked in the morning. Now, if you're on a birth control pill, remember the labs that you have checked are going to be a reflection of your birth control pill and not really a reflection of your own ovaries and what your hormones are actually doing. And it's going to be important. I'll talk to you later about how you become estrogen dominant, and one cause can be birth control pills. Okay. So you know when to get them checked. You now know that you have to get them checked. Why? And let's talk a little bit more about estrogen dominance. So the first situation is the most common, where estrogen levels are very high. This excess estrogen occurs because the body's making too much, or it's coming from an external source, or you're recycling the same estrogen over and over again because you're not detoxifying well. That's the first scenario. The second scenario is a scenario where you have estrogen dominance, but your estrogen level may be high or even normal, but you don't have any progesterone. The level is low. Estrogen dominance can be more common after pregnancy or in menopause or perimenopause because we have a rapid decrease of progesterone. Okay. So when you're in that second scenario, let's talk about why you would have low progesterone. So when you have low progesterone, there could be several reasons. One could be you have an ovulatory cycle, so you don't ovulate. So you may be someone who has difficulty getting pregnant or had numerous miscarriages, and that's because you're not ovulating and you're not producing progesterone during that luteal phase. So that's one reason that your progesterone level can be low. Another reason is you could be highly stressed. So stress is often a main cause of low progesterone. And we just did a podcast on stress, and I said stress can lead to disease, and this is a perfect example. So when the body is under stress, making sex hormones for fertility really kind of falls low on the priority list of the body. The body actually slows down production of progesterone in favor of production of our stress hormone, cortisol. So when you're trying to make more cortisol, your body's not going to make progesterone, and then you're going to have less of it. And then again, you're going to create a situation where you have too much estrogen and not enough progesterone, and you're not balanced. So very, very important. So it's really important that we have that adrenal fatigue taken care of because it allows your body to make the progesterone that it needs. The other reason that you may be low in progesterone is just because you're going through perimenopause to menopause. It's the very first hormone that we stop making when we start going through the change. And I see this quite often in my ladies who are in their late 30s, 40s definitely, and in their 50s. Now, why do you have too much estrogen? Well, there's actually a couple of reasons. So one is birth control pills. So hormonal birth control pills suppress our own body's production of estrogen and progesterone. It's like a negative feedback loop or mechanism. So the birth control pill floods our bodies with high doses of artificial estrogen and progesterone, causing our own production of natural hormones to basically be turned off. It can prevent ovulation, and it thins the uterine lining. And some women love being on birth control pills because their menses pretty much goes away, and this is the reason why. But if it creates a situation that leads to estrogen dominance, it can be actually doing more harm than good. Okay. The other reason that you can have estrogen dominance is you could be on hormone replacement therapy. So I see women come in on synthetic hormones prescribed for perimenopause and menopause because they have hot flashes and night sweats, but they're synthetic. They're not bioidentical. They're not exactly what the body makes itself. And when you take in a synthetic progestin, it's going to make your body make less of its own progesterone. Okay. Also low testosterone that we talked about before. The third reason why you might have too much estrogen is xenoestrogens. It's spelled Xenoestrogens, xenoestrogens. Xenoestrogens. And these are estrogens that come not from internal hormones, but from exposure to estrogen outside of our normal body. So it can be non-organic foods, it can be plastics, it can be the water supply, it can be our personal care products, chemicals that can mimic estrogen in the body. All of those things can cause these xenoestrogens to bind to the receptor and to make our body have too much estrogen. Think of soy, and we're talking about artificial soy, BPAs, phthalates, and parabens. So you really want to look at your personal care products. The other reason, so there's quite a few, I think there's 6 total, that we have too much estrogen is obesity. So excess body fat can be a source of estrogen. I told you that estrone can be made from our fat cells. Well, what happens is that when we have this excess fat, the cells have the ability to convert testosterone into estrogen through an enzyme called aromatase. Now, you don't need to know all the science about it, but what you do need to know is that when you have excess body fat, it causes you to have more estrogen. And it causes you to have the estrone that we don't like, the one that's 5-to-1 alpha receptor that causes proliferation. So reducing your overall body fat and losing weight will bring your estrogen level down. Now, the final thing I want to talk about is poor detoxification. So estrogen is detoxified in our liver, and then it's eliminated through our colon, which is our gut. So liver detoxification may be impaired in patients who might be what we call, they're not methylators. So I'm not going to go into the science here, but there is a gene mutation called MTHFR. And if you have a SNP, which means you don't have the gene, or you have a mutation of the gene, it can cause you not to methylate, which can cause you to have problems with detoxification or methylation. So what can happen is a number of things can happen here. So you might not break down your estrogen appropriately, and I will do a whole separate podcast just on estrogen metabolism and breakdown because it's so important in my female patients. But the other thing here is that you could also, if you're constipated and you're not having bowel movements every day, you could be recirculating the same estrogen through the gut and never lowering your estrogen levels. So again, very dangerous because then you have too much estrogen. It sets you up for all of those symptoms that I described earlier. So a lot of information. And I'm just going to tie in here that when you have estrogen dominance, it can lead to thyroid problems. And so a lot of times I'll have ladies come in and they'll be diagnosed with hypothyroidism, but they developed it later on in their life. And because they had too much estrogen. So estrogen can perpetuate inflammation and autoimmune disease in our body. And progesterone, I said earlier, is very calming and it's very anti-inflammatory. So if you're in a situation where you have too much estrogen, not enough progesterone, then the immune system can attack the cells and identify them as non-self. And so therefore you can get an autoimmune disease. And estrogen can enhance what we call our Th1 response. And low progesterone appears to do the same. So what happens is that these women can develop an autoimmune Hashimoto's, thyroiditis, or hypothyroidism because of their hormones being imbalanced, because of having too much estrogen and not enough progesterone. So it is important. It affects our body in multiple ways. What can you do about it? First thing you can do is get your labs checked, a progesterone and an estradiol E2 level. Get them done during the 3rd week around day 21, but you have a range, day 19 to 21 of your cycle. If you're not on birth control pills, or if you're perimenopausal and you want to know what your labs are, get them done around day 21, 19, 20, or 21. If you're menopausal, you can get your labs done at any time because you're not having a menses, and so therefore the day doesn't matter. The second thing I would tell you to do is you can actually have your progesterone to estrogen ratio calculated. Now, you may want to seek out a functional medicine physician who is familiar with doing this test and this calculation. But if you do it, usually the units have to be changed for progesterone to estrogen. So usually you do progesterone number, multiply it by 1,000, divide it by your estradiol number, and it will give you a particular number. And you want that number to fall between 100 and 500. If it's less than 100, then that means you're estrogen dominant. And if it's greater than 500, that means you have too much progesterone. Now, I rarely see too much progesterone. I always see too much estrogen. So let's say your number for progesterone was, I'm going to say 4. And then you're going to times that times 1,000. And then let's say your estrogen number was 225. So you divided that 4,000 by 225 and you get a number 17.7. So that's a person who's very estrogen dominant because we want that number to be at least 100. Okay. And most of my ladies who are feeling really good, fall between 150 to 200 kind of as their ratio that makes them feel balanced. But again, remember, hormones are just like fingerprints. So these numbers are not universal. They're specific for you, but more importantly, how you feel clinically. So if I put someone on a progesterone cream to balance out their progesterone, or if I put them on an oral progesterone, again, a natural bioidentical progesterone, then I'm going to check them in 3 months and I'm going to recalculate that number. But more importantly, I'm going to talk to them and say, hey, are your breasts tender? Are you sleeping through the night? Has your hair loss stopped? Did your PMS go away? Do you have water retention? Have you noticed that it's easier to lose weight? Have your periods started regulating? So those are the things that we're looking for. Is your brain fog going away? That's what we're looking for when we balance out your hormones. So it's not just a number, it's clinically how you feel. This podcast is brought to you by Orthomolecular Products, the exclusive supplement company of the Wisconsin Institute of Functional Medicine. Orthomolecular has been a leader and an innovator in the functional medicine space since it was founded over 31 years ago. They follow the latest science and combine the highest quality of ingredients to produce effective nutritional solutions for clinicians to use with their patients. By controlling the entire manufacturing process, they know exactly what is in each capsule, and they offer products free of allergenic additives and preservatives. This is one of the many reasons I decided to carry Orthomolecular products in my office. You can book an appointment today to learn more about how my team and our partners at Orthomolecular can help you reach your health goals. Call us at 920-380-9890 or visit us on our website at wisconsinfunctionalmed.com. That's wisconsinfunctionalmed, all one word, .com. Orthomolecular Products, because efficacy and your health really matter. So you may be wondering at this point, well, I don't know if I want to go get my hormones checked. And also too is I don't know if I want to take hormones. And those are good questions. And that's personal. It's a personal decision for each person. But I will tell you, there are some dietary recommendations and some lifestyle recommendations that you can start implementing right now just to balance out your hormones. So let's go through those because they are very important. And actually, this is where I start with all of my patients. Now, it is true that some of my patients, I put them on hormones because their number is so low and I'm concerned for them. But I never do that without talking to them first about diet and lifestyle, because the foundation of everything you do comes down to everything you do every day. So diet and lifestyle. So let's talk about those. So the first one is cruciferous vegetables. Think of things like broccoli sprouts, turnips, cauliflower, cabbage, collard greens, and kale. Those are all cruciferous vegetables that contain indole-3-carbinol, I3C, and they contain DIM, okay? Diinodiylmethane. And I don't know if I said that right. I think I remembered it right, but it's DIM. Why is that important? Because those two compounds support estrogen metabolism and detoxification. And that's what we want to do. If you're in an estrogen dominant state, we want to make sure that you're metabolizing the estrogen and you're detoxifying. The other thing that you want to make sure you're doing is getting that fiber in. So we talked about a goal of 30 grams of fiber. Fiber supports our microbiome. It's important for estrogen metabolism and detoxification. It also helps keep you having regular bowel movements. And remember, when you're constipated, you just keep recirculating the same estrogen over and over again. So if you cannot handle a high fiber diet, then we have to figure out why. Do you have small intestinal bacterial overgrowth? Do you have a leaky gut? There's a reason why you can't handle fiber. So we want to make sure that you're getting your fiber in. The third thing you can do is you can choose high quality animal products. Now, when we have hormones, and especially growth hormones in our meats and in our dairy products, they can affect your estrogen level and cause you to have high estrogen. Because remember, we talked about Xenoestrogens, so they're found in conventionally raised meats and dairy products. Now, I didn't grow up on organic meats and vegetables. Grew up in a very middle-class, humble home, and we ate what was put in front of us. And you may be in that situation. So I just say choose wisely. At this point in my life, I can choose to have organic meats if I want. We don't always have organic meats. We just try to really choose wisely and make sure that I'm doing all the other things as well, eating my high fiber foods, eating cruciferous vegetables, managing a few other dietary things I'm going to talk to you about. But just choose what you can. If you can have grass-fed and organic, go for it. If it's too pricey, then just make other choices, but try to make good choices. The other thing I would tell my patients is watch your alcohol consumption because it is associated with higher levels of estrogen, and it can impair liver detoxification of estrogen itself. So I've never been a big drinker, To me, it's kind of like an onion. It sits on the counter if I want it. If it's right time, right place, right situation, I may have some. For other people, it's a regular part of their diet. So I would just say if you are high estrogen and you're trying to bring your level down, then maybe alcohol is not the best choice. If you're not a big drinker, don't start now. And if it's something that you like to do on the regular, then I would say try to do something that doesn't have a lot of sugar in it because that will help with your blood sugar, maybe a white alcohol. And then just save it for the weekends or once or twice a week at the most. You want to reduce or eliminate caffeine because caffeine is associated with higher levels of estrogen. And reducing caffeine can also help to lower your cortisol levels and balance out your adrenals. And remember, if you're highly stressed, you're not going to make progesterone, right? And we need progesterone in order to balance out estrogen. And then some people like to implement a dietary change. So sunflower seeds and sesame seeds are really good at producing higher levels of progesterone because it helps with zinc and vitamin E production. And so also yams are really good. So during your luteal phase, when you want your progesterone to be high, which is after day 14, make sure you have those in your diet. Okay, let's talk about lifestyle recommendations. So, those are the dietary recommendations. Here are some of the lifestyle recommendations that you can do in order to help balance your estrogen to progesterone if you're estrogen dominant. So, if you're on birth control, especially synthetic birth control, which that's the only kind there is, unless you have an IUD that's a copper IUD, then you have to really kind of think about that because what can happen is that birth control, again, is stronger than your normal ovaries. And so it's going to cause you to produce less of the natural progesterone that your body needs in order to balance estrogen. And also, that birth control pill has estrogen in it. So that estrogen is binding to your estrogen receptors. You want to clean up your personal care cleaning products. On average, we use about 12 personal care or cosmetic products per day. So that's a lot of chemicals that we're putting in our body if they're not clean and natural. So again, this kind of goes back to the organic. And I tend to notice that things that are good for you are more expensive, which is a little frustrating, I think. But I would just say really, be mindful of what you're putting on your body because things do absorb through the skin. So this is where I did make some changes. I only use paraben-free, phthalate-free, natural lotions, soaps, different things like that, hair products. I'll be honest, I love to go to Ulta. And who doesn't like a pretty eyeshadow and, some new lipstick? And although we're wearing at this time mask all the time, so there's no point in wearing lipstick. But so I really do like to have fun with the makeup thing, but I am mindful. And so I do try to choose products that have the least amount of chemicals. Filter your water. So make sure you're getting high quality water. Do not drink your water out of plastic water bottles if you can. Avoid that because, again, you'll get those xenoestrogens that can mimic hormones. So be very careful. Also, you want to prioritize your sleep. A lot of our detoxification happens during our sleeping hours. So make sure that you're getting proper rest. And we talked about 7 to 9 hours. And I am going to do a podcast on sleep. So make sure you listen to that if you're having trouble sleeping. But hormones really regulate our sleep cycle. So we can balance out our hormones. We usually start sleeping better as well. You want to sweat. So we talked about detoxification. So it happens through sweat. Our skin is one of the largest organs in our body. So exercise or sauna, sweating really plays a role in detoxification. Our liver helps us detoxify. Our kidneys, when we pee, helps us detoxify. And our bowels, when we have bowel movements, help us detoxify. So, but out of all of those, sweating is really important. And then you want to relax and reduce your stress. Because remember, if you're stressed, you're pulling from cortisol, and cortisol then pulls from progesterone, and you're not going to make progesterone. And also, too, is your body's not going to think about making progesterone when it's super stressed because it's trying to survive the fight or flight response. So therefore, progesterone is difficult to make, and therefore, you have to go on some progesterone if you can't really make it yourself. So really try to reduce your stress. It can support your sex hormones and your thyroid hormones. Chronic stress can cause fatigue, and therefore your adrenal glands won't work well. And then finally, you can consider some supplements. Usually this is the last thing. It's not the first thing that I ever talk to my patients about. There are a multitude of supplements out there. So my best advice to you is to see a functional medicine doctor or see someone who specializes in this area so they can really guide you. But I would say food first, food first, lifestyle first. Those things always trump any type of supplement. The supplement is a supplement. So it supplements what you should be doing. And sometimes, I give my patients supplements that have pregnenolone in them because it's a precursor for progesterone. Sometimes we actually replace progesterone. And again, it's like a fingerprint. So you can't, one size doesn't fit all. So just don't go buy progesterone cream off over the counter because you really need to have your levels checked. And then I use things that have combination of DIM or Indo-3-carbinol in them, and also milk thistle for the liver. But again, I have looked at the patient's labs and I have determined whether or not they're detoxifying. I didn't really talk to you about MTHFR, which is a genetic lab that we look to see to make sure that you're methylating. So I am going to do a separate podcast on methylation and detoxification because it deserves its own discussion. But if you have impaired methylation, because you have an MTHFR gene mutation, which is really common in autoimmunity or in patients who are not detoxifying their estrogen, these factors can affect your liver and it can affect how you detoxify. So again, I've checked these labs in my patients. And so someone who might have an MTHFR, then I may give them a methylated B vitamin because it's already been methylated since their body won't methylate. So always work with a practitioner to make sure that you're getting proper care and that you're getting your questions answered. So the main takeaways from this discussion is really, one, do you have the symptoms of estrogen dominance? So go back and listen to what those are. If you do, two, get your labs checked. And if you're not on birth control, get them checked during the 3rd week of your cycle. So anyone who just checks them randomly, I'd be a little cautious about that unless they're also checking an FSH so they know where you are. But really, to determine if you're estrogen dominant, you want to do it during the luteal phase, which is the second half of your cycle, day 19, 20, or 21. Okay, those are the important things to remember. And then if you need help calculating your ratio, you can always reach out to us or have your practitioner calculate it for you. And then implement the dietary and the lifestyle changes that I spoke about, because it really comes down to what you do every day. Okay. And you have control over how you age, the way that you age. And you have control over whether or not you're going to have some of those symptoms. And you can change the trajectory of how you feel by making changes and making sure your hormones are balanced. This is so important. And I just want to stop for a moment and just really help you realize how important this is. The things that are on that list are breast cancer, ovarian cancer. Those are big things, right? Hypothyroidism, brain fog where you can't think. So these are big things that you could avoid. Endometriosis. I see so many women who get hysterectomies because of endometriosis. So you can change the trajectory. If you're young, you still have time to make changes. And if you're older, you can still make changes and get better. I've seen it over and over again in my patients. So I really hope this information resonates with you. You may have questions, and I am going to do a content download that gives more information. So we will have the website listed so that you can download the PDF that will give you some more information about this important topic. So I hope that you know and remember that you have an opportunity here to make some lifestyle changes, make some dietary changes, get some more knowledge so you know whether or not you're estrogen dominant, because you can change the trajectory of how your genes and how your life turns out based on what you do. So there is a concept called epigenetics, and basically they looked at twins, and they take two twins who have exactly the same genetic makeup and they put them in two different environments. And that's the epi part of the genetics. It's epigenetics, the environment from which your genes sit in. And they can look at them and they can see one twin that lives one lifestyle, which might be fast food, poor sleep, a lot of stress. And they can put another twin who lives a lifestyle where diet and exercise are a regular part of their day. They make good choices. They learn to manage their stress because we can't get away from stress. We all have it. And they can look and see that one person may develop disease and another person doesn't. One person may gain weight and the other person doesn't. One person may have breast cancer and the other person doesn't. They started out with exactly the same genetic makeup, but because of their choices and because of their lifestyle, then different things developed. So I just want to empower you to make choices, to educate yourself so that you can determine how your next 50 years are going to be, how you're going to feel. And it's not going to happen overnight, but I will tell you, if you stick with it, it happens. I see it every day. I get letters from patients that say, oh my gosh, you just told me if I listened to what you said. I actually had a patient that write that, said, you told me that my life would look totally different in 1 year if I just followed what you said. And she wrote me 1 year later, 50 pounds of weight gone, and her life looked totally different and she felt totally different. And it was one of the best notes I ever received from my patients. So I too tell you that if you make changes, your life will be different in a year. And it sounds like a long time, but a year, they go by quicker and quicker all the time. You are worth a year of investing in yourself. I hope this helps. I'll talk to you soon. Take care. This is an important reminder. The podcast is for educational purposes only and is not a diagnosis or a prescription for care. Please consult with your healthcare practitioner before moving forward with any of the therapies or treatments discussed in today's podcast. If today's topic resonated with you and you want more information, please check out our website, wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Also, for those of you who want further assistance with weight loss, consider our online weight loss program called The Pause, which can be found under Services. We really focus on helping you reach your weight loss goals. We provide a supportive and interactive and engaging environment, which is led by me, Dr. Tracy Page, so you can get all the help you need. Remember, you can change the way you age, and I'm here to help.